We welcome you to the Orthopedic Spine Services Preoperative Education class, education at your fingertips. On behalf of Ridgeview and Twin Seat Orthopedics, we are pleased you are taking time to invest in your education before your spine surgery. Preparation is key to a great outcome. Let us begin by discussing details to help prepare you for surgery. Please turn to the preoperative information section in your education and resource guide. You will need to schedule a preoperative appointment to complete a history and physical exam with your primary care physician within 3 weeks of your surgery date. Bring with you the form titled Preoperative Anesthesia Requirements Form. This is also a good time to talk to your provider about diabetic and heart medications and discuss if you should take them the day of surgery. You may also need to schedule other appointments as directed by your primary care provider if necessary for preoperative clearance. The preoperative checklist is a great tool to help you complete all the necessary preparation before surgery. It is very important to prepare your home for return from the hospital. Walk around your home, clear away any clutter, and pick up scattered rugs. You should have a sturdy chair with arms on it. This will help you to be able to get in and out of the chair. A grab bar for your shower, perhaps, can be permanent or removable. Arrange someone to collect your mail, do laundry, or prepare meals. Sturdy railings make all the difference. If you do not have a railing on your stairs, we recommend getting one installed before surgery. If you have a railing, make sure it's sturdy enough to push through without collapsing. Look at all your stairways, including those outside, and make sure you have railings installed where you need them. Encourage you to review the fall prevention safety tips handout in the preoperative information section. Your surgeon recommends a routine dental cleaning before your surgery. Check with your surgeon for recommendations on how long to wait after surgery for routine dental cleaning. Using an antibacterial soap on your skin before surgery is recommended. Antibacterial soap begins to kill germs on contact. Purchase an antibacterial soap at your local general merchandise store. The night before your surgery, use the antibacterial soap to wash your body in preparation for surgery. Note: no lotions, deodorant, or perfumes should be used before your surgery. Go to bed in clean sheets and clean pajamas. Smoking decreases the rate of skin and bone healing. This can impact the success of your spine surgery. Nicotine impedes healing by constricting blood flow in the body. Nicotine can also increase your risk of blood clots because nicotine is sticky and can cause your blood to clot more easily. Make a plan to quit. Talk with your primary care provider for smoking cessation options. It is best to not quit cold turkey without help. Also, your surgeon requires that you be nicotine-free for 4 weeks prior to surgery. The Ridgeview campus is a smoke-free campus. You will not be allowed to go outside to smoke. The goal before surgery is to be as active as possible. Being active will assist in your recovery after surgery. Avoid positions and activities that increase your pain and discomfort. Ask your surgeon and physical therapist, if you have one, about the exercises most appropriate for you. Consider adaptive equipment needs you may need at home. You may purchase most of the equipment that you will need from the hospital Ridgeview Home Medical Equipment Store. We have 2 convenient locations. The first location is up on the 3rd floor of the hospital. The second location is across from the hospital. Please note equipment will not be available for purchase on Saturdays and Sundays. If you have your own walker or cane that you plan to use, bring the adaptive equipment to the hospital so a physical therapist can make sure it is fitted correctly for you. If you do not have your own walker, the physical therapist can issue you a new walker before you go home and bill your insurance. Please check your insurance coverage for cost of assistive devices for each plan is different. Not all spine surgeries require a custom brace. If your surgery requires a custom brace, your surgeon will have Rebound Orthotics and Prosthetics call to schedule an appointment to have your brace fitted a few weeks prior to your scheduled surgery date, or you may be given a brace while in the hospital. You should begin planning for your recovery prior to coming into the hospital. Your length of stay in the hospital will depend on your health before surgery, the type of surgery, pace of recovery, and how well you prepare yourself before coming to the hospital for surgery. Most patients are able to go directly home after discharge and recover in their own environment. Arrange to have a responsible adult, such as an adult family member or a trusted friend, to drive you home and stay with you for 24 to 48 hours. Remember, you will not be able to drive for approximately 2 to 6 weeks after surgery. During your hospital stay, if you need assistance at home, our home health liaison will help verify insurance coverage and arrange. Social Services Department is available to answer questions and help make arrangements for after-hospital care as needed. Ridgeview's Orthopedic Spine Care Coordinators can assist you with any discharge planning questions you may have. Contact your insurance provider to understand the specifics of your medical coverage for both your surgery procedure and hospital stay. Blood thinning agents should be stopped before surgery to reduce the risk of bleeding. In your guidebook, follow the recommendations when to stop taking your blood thinners, unless directed otherwise by your physician. Coumadin and warfarin, stop taking 5 days before. Eliquis, Xarelto, Plavix, Pradaxa, aspirin, stop taking 7 days before. Please note, if you have been prescribed a blood thinner, call the physician who prescribed to find out when to safely stop. Anti-inflammatory medications known as NSAIDs should be stopped 10 days before. These include Motrin, Advil, ibuprofen, Aleve, naproxen, naproxen, Celebrex, diclofenac. Supplements, such as fish oil, should be stopped 14 days before surgery. Please inform your physician at your physical about all your supplement and vitamin use to help guide when best to stop before surgery. Acetaminophen, also known as Tylenol, may be used for pain relief before surgery. Follow directions on the bottle for extra strength or regular strength Tylenol. Do not exceed 4,000 milligrams of acetaminophen or Tylenol in 24 hours. Call your primary care provider or surgeon if you need help with managing your pain 10 days before surgery. A nurse from the Ridgeview Surgery Department will call you the last business day before your surgery. If your surgery is on a Monday, you will receive a call on the Friday before. This nurse will provide you with final instructions to prepare you for surgery, which includes the time your surgery is scheduled, when to arrive at the hospital, and when to stop eating and drinking. If you miss the call from the surgery department, they will leave a message for you to return the call. Pack light. We want to try and minimize the amount of exposure to germs that your personal items receive. Having fewer items will help with this. Bring loose-fitting clothes to wear while in the hospital. Recommend to dress in layers as room temperature varies. Also, bring a pair of safe, sturdy walking shoes. Don't forget to bring containers to store safely when you are not using such items as hearing aids, dentures, and glasses. Patients with sleep apnea, it is very important to bring your CPAP machine. Distilled water will be provided. Bring personal hygiene items you may need. If you wish to shave, you will need to bring an electric razor. Avoid bringing any valuables and limit cash to no more than $50. Wi-Fi is available. You may use your cell phone or tablet. A USB port for charging will be available on your hospital bed. On the day of surgery, the surgery entrance, located on the west side, is where you should enter the hospital. Bring your insurance card, photo ID, and medications so you can begin the admitting process. Please note, bring all prescription and non-prescription medications, vitamins, and supplements in their original container so we can accurately enter into your health record. Even if you do not plan to take vitamins or supplements at the hospital, please still bring with you. Your surgeon will review, and your discharge nurse will then be able to educate when to safely resume after your surgery. Refer to the Education and Resource Guide for a complete list of what to bring to the hospital. Plan to be away from work or free of social obligations for at least 2 to 4 weeks. It takes time for the body to heal and regain strength and stamina. When you return to work, go back gradually. Consider 4 hours at a time if at all possible. You and your surgeon will decide when you are ready to return safely back to work. Remember, you will not be able to drive for approximately 2 to 6 weeks after surgery. Handicap parking permit is available from your surgeon's care coordinator. Once complete with your surgeon's signature, recommend to drive the completed form to the DMV office instead of mailing. We will talk about topics related to your hospital care. Turn to the hospital care section. The use of incentive spirometry after surgery is important to help reduce postoperative lung complications and to maintain a clear open airway. After surgery, both anesthesia and pain medication, along with decreased activity, cause your lungs to be more relaxed so you do not breathe as deeply. Think of using incentive spirometry as an exercise for your lungs, which allows them to work like they should. Perform a slow, deep breath through the mouthpiece at least 10 times an hour while you are awake. Do not exceed 5 inhalations in a row to prevent lightheadedness. Your nurse will review how to use the incentive spirometer after surgery. Continue to use for 2 weeks after surgery until you are up and moving frequently. Our spine care coordinator will discuss our current visitor guidelines with you and answer any questions you may have. We will discuss topics related to managing your pain after surgery. Please turn to the pain management section. Resting in the initial weeks after surgery is beneficial to help with managing pain and inflammation. Pain, swelling, and overactivity are all related. The key to managing all three is rest. While it is important to do your physical therapy and walk, you also need to take time to rest. Limit sitting up in a chair periodically throughout the day for 30 to 60 minutes at a time. Using ice frequently in the initial weeks after surgery is beneficial to help with managing pain and inflammation. Ice several times per day for 20 minutes at a time. Use ice after physical therapy exercises, activity, including excursions like grocery shopping. You may continue to need ice for a few months after surgery. This is normal. Purchase of ice packs and ice pack covers are available through Home Medical Equipment at Ridgeview. You will need to use a cover with your ice packs to protect your skin and incision. You may be concerned about managing your pain after surgery. It is expected that you will have pain. The goal is for you to be functional in your daily activities with a tolerable level of pain. If you had numbness and/or weakness in your arms or legs prior to surgery, this can take several weeks to months to go away. If these symptoms are present for more than a month before surgery, this can sometimes be permanent. Taking pain medication about 60 minutes before exercises will help keep your pain under control and increase your mobility more quickly. In the hospital, you will use a scale that goes from 0 to 10 to describe how much pain you are having. A score of 10 would mean you are hurting as much as you can imagine. On discharge, most patients will be given a prescription for oral narcotic pain medication through a paper prescription or electronically sent to your pharmacy. In addition to your narcotic prescription, you may also receive a prescription for other medications to help with pain such as muscle relaxants, anti-inflammatories, or nerve medications. Narcotic and other pain medication you will use do have side effects, including nausea and vomiting. To avoid, take pain medication with food and 4 to 6 ounces of water. Another possible side effect is becoming lightheaded and dizzy. You should sit down or stay seated until your head clears. Stand up slowly to avoid unsteadiness. Other side effects may include itching, drowsiness, poor memory, and constipation. Review in the pain management section, Understanding Your Prescriptions, to learn more about how to use the most common prescribed narcotics after your spinal surgery. Contact your surgeon if side effects become severe. Contact your surgeon's office for pain medication refills. Pain medication prescriptions will not be filled after business hours or on weekends, including holidays, by another surgeon. Arrange a time to look through your pain medication on Wednesday or Thursday to make sure you have enough to get you through the weekend. Contact your surgeon's office during regular business hours to discuss your pain medication refill. A written prescription must be picked up at the surgeon's office or mailed to your home. No narcotic refill prescriptions will be allowed after the 4-week postoperative appointment. Narcotic pain medication, lack of activity, and anesthesia can cause constipation. Stool softeners are prescribed by your surgeon on discharge when taking narcotic pain medication. Examples of over-the-counter medications that provide effective constipation relief include Senokot S or Colace, Miralax, a suppository, a saline enema, or prune juice. These can also be purchased over the counter. Stool softeners will be essential until you are off narcotic pain medication. Do not exceed 3 days without a bowel movement. We also recommend increasing your fiber intake by having on hand fiber bars, high fiber cereals, fruit or juices. Increasing your fluid intake will also help with constipation relief. Note, if you deal with constipation normally, generally increasing medications to relieve constipation will be necessary, such as possibly adding Miralax. If you struggle with irritable bowel symptoms, sometimes these medications can cause diarrhea and should be used with caution. The greatest risk of a blood clot occurs in the first 30 days after surgery. To help prevent painful or dangerous vein clotting, we will have you do a number of things to reduce the risk. Number 1, perform foot and ankle pumps 20 times each hour when you're awake. Number 2, walk, engage in frequent activity. Number 3, you may be asked to wear compression stockings for up to 2 to 4 weeks after surgery. It is important to get up and move in order to keep circulation going through your legs, balancing activity and rest. Following all recommendations on incision care after surgery will minimize your risk of developing an infection. Your incision will be closed with absorbable sutures that will dissolve. Nothing will have to be removed. Your steri strips, which are small pieces of tape over your incision, will fall off naturally after approximately 7 to 10 days. Do not pull off the steri strips or any stitches. Change your dressing daily and as needed if it becomes soiled or wet for 2 weeks after surgery. Your discharge nurse will show you and your coach, if available, how to change the dressing. Wash your hands before and after changing the dressing or touch incision. You will be provided with dressing supplies to take home during your hospital stay. Monitor your incision and report any signs of infection to your surgeon. Signs of infection are increased swelling and redness in the incision area, change in color, odor, or amount of drainage. Some drainage is normal, a fever greater than 101 degrees Fahrenheit, increased pain in surgical area, skin around incision is hot to touch. Watch for developing an infection in any wounds or cuts you may get in the future. Do not let an infection get out of control. Clean all cuts and wounds and use an over-the-counter antibiotic ointment. Follow your discharge instructions to determine when you may begin showering after surgery. Do not soak your incision in a bathtub or hot tub for 4 to 6 weeks after surgery and your incision is healed. When showering, remove gauze bandage over incision. After shower, pat dry around incision, being careful not to touch the incision. Place new gauze bandage over the incision. Your doctor and physical therapist will encourage you to begin a progressive walking program as soon as possible after surgery. Walking is a low-load activity, ideal for most people during their recovery from spine surgery. While you are in the hospital, you will be encouraged to walk once you are able. On the day of your surgery, your activity goal will be to transfer up in chair and begin walking in hall. The day after surgery, the goals include walking in the hall 3 to 5 times a day. By the 4th day after surgery, you should be walking for 5 full minutes up to 4 times a day. Activity guidelines and goals are used to help advance your activity over the next several weeks. Your surgeon may have you wear a lumbar brace for your back or cervical collar for your neck while up and walking based on your surgery. Follow your post-op spine walking schedule if you have been given one. Benefits of participating in a walking program are many and include helping your bones fuse by increasing blood flow to the area, improve muscle strength and endurance, and lastly, less pain. At the hospital, the rehab team, including a physical therapist, will help you get moving, teaching you exercises and how to walk and function after your spine surgery. An occupational therapist will teach you techniques and how to dress and bathe using appropriate precautions and adaptive equipment if needed. Functional activities are a part of your everyday routine, such as bathing, getting into or out of a bed or car. Refer to the Functional Activities section in the Post-operative Activity Guidelines for more tips. You will follow up with your surgeon approximately 2 to 4 weeks after surgery to check on your recovery progress. This appointment will be made either prior to surgery or before you are discharged from the hospital. Avoid lifting more than 10 pounds for 4 to 6 weeks after surgery. Avoid activities that cause you to bend or twist for 4 to 6 weeks after surgery, such as raking. You must be off all narcotic pain medication and muscle relaxers before you can drive. You will not be able to drive for approximately 2 to 6 weeks after surgery. Feeling comfortable operating your vehicle safely is very important. For additional resources on patient education regarding your surgery procedure, check out Twin Cities Orthopedic's website. Under Specialties and Patient Education, virtual videos are available of your surgery. Our spine care coordinator can provide you with detailed instructions of how to navigate to access these videos. Did you know that Twin Cities Orthopedics has a walk-in urgent care clinic that is available to you? After surgery, if you have any concerns or issues, your surgeon wants to hear from you and may need to see you in person. If a concern or issue occurs after normal business hours, walk into one of their urgent care locations. Urgent care hours are 8 a.m. to 8 p.m., 7 days a week. If your concern or issue is life-threatening, call 911 or go to the nearest ER. Urgent care is available in Waconia. Please see Twin Cities Orthopedics website for other locations. Twin Cities Orthopedics has a surgeon on call 24 hours a day and can be reached by calling their office. Our spine care coordinators are available if you have any questions or concerns both before and after surgery at 952-777-5383. Ridgeview's Orthopedic Spine Services is a comprehensive program designed to offer you the best medical and rehabilitative care. We hope this time spent will provide you with confidence before your spine surgery. Thank you for choosing Ridgeview and Twin Cities Orthopedics for your care.